next section in cardiovascular pharmacology will be medication use or drugs, medication use for heart failure. Okay, so this PDF file maybe present the list of medication used for heart failure. We have sacubitril and valsartan combination treatment and the brand name Entresto. Um, we have ivabradine, corlanor. We have digoxin, lanoxin. We have the butamine. We have Mirinon, Fersiguat, dapagliflozin, Forxiga, empagliflozin, Giardians, isosorbate dinitrate. Then we have nitroglycerin, nitroprusside, hydralazine. As you can see, the last one here, we have combination between the hydralazine and isosorbate dinitrate, the brand name Bidil. So in the PowerPoint slide, we are going to maybe speak a little bit in summary about the most popular medication in the practice. So moving to the next slide, only to be on the same page, me and you together. So drugs used for the heart failure, generic brand drug, the pharmaceutical form. As you can see here, the first medication on the group sacubitril and valsartan, the brand name Entresto, belong to the ARNI, neprilysin inhibitor plus ARBs, neprilysin inhibitor plus ARBs. AR stand for the ARBs for ARNI. ARNI, neprilysin inhibitor. So ARNI coming from ARBs inhibitor plus neprilysin inhibitor. So what we have here, this is Entresto, the brand name, the first medication for heart failure with reduced ejection fraction, reduced mortality, and reduced hospitalization percentage. This medication available as a tablet, 24 to 26 milligram, 49, 51 milligram, 97, 103 milligram. So different dosage available depends on the progressive of the disease. Ivabradine, corlanor, ivabradine, how this medication work? This medication blocks sodium channel in the heart, blocking sodium channel, used for heart failure with reduced ejection fraction, HFrAF, with when we have elevated heart rate, because this medication ivabradine decrease heart rate. So it's very important. If the patient suffers from bradycardia, we cannot use this medication. Okay, so the heart rate, when we need to use medication, the heart rate need to be more than equal 70 beat per minute. Ivabradine available as tablet or oral solution. Digoxin, lanoxin brand name belong to the cardiac glucoside. How this medication work? This medication block pump called sodium potassium ATPase. In addition to the vagomimetic, that mean um, vago stand for acetylcholine. Okay, so the vagomimetic here associated with the maybe explain decreasing the heart rate here. Digoxin decrease heart rate by vagomimetic by the acetylcholine effect. Okay, the digoxin, we use it for heart failure with the reduced ejection fraction, HFrAF, relief symptoms. We can use it for the atrial fibrillation because they found that digoxin control the rate of the heart. Digoxin available as tablet, and you can see the tablet 0.0625 to the 0.25. So we can escalate those for the patient. Available as solution and injectable here. Fersiguat and brand name Fergovo, available. This medication stimulate guanylate cyclase. We can use Fersiguat for someone suffering from worsening symptoms of chronic HFrAF. Dobutamine, Dubutrix, the brand name Dobutamine, Dubutrix. This medication belongs to the beta 1 agonist, positive inotropic, increase contractility of the heart, stimulate the heart. We use the dobutamine for someone suffering from acute decompensated heart failure, cardiogenic shock. Then we have this medication available IV, injectable, and also could be premixed. butamine. Okay, we are still talking about heart failure. As you can see, we have milrinone available as generic only. We don't have brand name. PDE inhibitor stand for the phosphodiesterase inhibitor 3. We have several type of phosphodiesterase. Milrinone used for acute decompensated heart failure, short term. Could be used for refractory heart failure when the patient may be in the process for cardiac transplantation. Okay, this is another medication for the acute decompensated heart failure. If you go back there, you can see here the butamine for acute decompensated heart failure, cardiogenic shock. So we have milrinone for acute decompensated heart failure. Dapagliflozin, empagliflozin, two medication, dapagliflozin, empagliflozin belong to the sodium glucose transporter here inhibitor, sodium glucose transporter inhibitor. Dapagliflozin brand name for SIGA, empagliflozin brand name Jardiance. This medication used for the heart failure, even for half RAF or half PAF. So reduce ejection fraction or with the preserved ejection fraction. Dapagliflozin, this medication used for patients of from type 2 diabetes. Also, we use it for patients of from CKD, chronic kidney disease. Empagliflozin, the same apply, half RAF, half BAF, type 2 diabetes, CKD, and they found this medication, empagliflozin, reduce death of cardiovascular disease. Both of them available as a tablet, 5, 10, 25 milligram. Moving to the next medication, nitroglycerin. Nitroglycerin, nitrostat there, or nitrodor, brand name, organic nitrate, release nitric oxide, or consider like NO donor. Nitroglycerin used for angina, even for acute or prophylaxis, acute heart failure, pulmonary edema, hypertensive emergency. Available as sublingual tablet, SL stand for sublingual tablet, available as spray, available as skin patch, available as ointment also, and we have extended release capsule. You can see here for the heart failure, it's like repeated interstitials or covered in the previous slide.